Hello. Hello, hi everyone. This is Dr. Muska. Welcome to the live stream of LearnElevate. LearnElevate, right? Of course, the whole point of learning is elevating ourselves in our lives. Now, majorly, our LearnElevate Academy is majorly for medical students. It's completely for medical students and majorly focusing on building really good doctors all the way from different countries, right? I've known different countries like Armenia, Kyrgyzstan, China, Russia, right? Now, let me tell you a little bit about our academy and then we'll jump right into how exactly we're going to learn different subjects by different specialists of the subject. We'll go in detail. Of course, this is a live class. I would love you guys to write down if you want to write down something. And do not worry, whatever is taught in this class will be repeated again. Okay? Right now. So, starting with what exactly is LearnElevate? Now, LearnElevate is our academy that has been founded by, of course, one of the founding members is me and five other doctors as well, and majorly three important people. Okay? And one of them, the major one of them is Dr. Alamin, right? He's a final year student in one of very prestigious Russian institutes, Russian academies, and along with him is Dr. Nail and also Dr. Aman. It is their hard work and their complete dedication, of course, they have put in to get this to guys like you. Okay, very bright minds, had a contact with them, love their idea. I'm very happy to be a part of it. Okay, now, पहली चीज़ यार, what exactly, why exactly do we need LearnElevate? ठीक है, we already have different kind of XYZ academies and applications and this and that. Why exactly are we different? Right? That comes to us. Now, let me be very clear. This is not just for you guys to come and just listen and clear the FMGE exam and then go into our any PG exam or maybe do a job somewhere. No. It's not like that. We are trying to build your basics all the way from your first year in your medical colleges there itself. Okay, we want you guys to be able to get the proper education, proper reach to proper guidance, of course, and then learn it as it flows. I don't want you to wait 6 years in Russia, Kyrgyzstan, China, wherever it is, and unable to understand, unable to cope with the stress maybe sometimes, right? We need our thing. We need to give our help to those guys who have having problem with all of these, right? It is a very important thing that you guys should know. Now, if you look at the different data, there are many thousands and lakhs of students who are doing their MBBS outside India. Okay, that's very important that we provide proper education to those as well, because India is in a need of very high amount of doctors. Don't let this thing come into your mind here. I have done my education, I have done my graduation outside India, so maybe I'm not at that level. No, of course not. It's not like that at all. One of the few doctors I know has done their MBBS from China and is a renowned surgeon right now. And not even just a normal surgeon, he's a very important, very famous liver surgeon. Okay, and then a few of them are orthopedic surgeons being really good with their field. So get this thing in your mind. Okay, it doesn't matter where you do it from. It matters how you put in your complete interest into it and learn it. Of course, there are two important things. The first thing is learning the subject and learning the practicals. Okay, being a of course doctor is not just learning bookish knowledge. We need practical knowledge as well. So we will focus on both of these, right? But remember, बिरयानी बनाने से पहले चावल बनाना सीखो. ठीक है. So that's good. That's where we will come in, of course, in the starting phase, where we will teach you all the way from the basics. We are now focusing on the first year and second year subjects to build your basics. Of course, we will now start this with only these, first and second year, but we will again get into third year and final year, ENT, Opthal, SPM, medicine, all subjects will be covered. Everything will be covered, right? Along with practical help as well. We are trying our best to make sure that there is no difference between a medical graduate coming in from India or maybe from Russia or China. Okay? Everyone has their own things, the reasons, and whatever it is. To get it from any other country or this country doesn't matter. It all depends on how focused you are. कितना आप लोग अपना मेहनत लगाओगे, right? That's very important, right? So I hope you guys are fine with me talking in English as well as Hindi में भी बात करूँगा. अప్పుడు तेलुगुలో మాట్లాడతా. See, it's India is a very diverse. I don't know Tamil, of course not, but I learn a little bit if I see a lot of Tamilians join. Right. Drop a like at the stream. Of course, it helps. Comment if you want know a few things. I'm looking at the live comments as well. I'll give you a reply, of course. Okay. Now, basically, when you talk about what exactly is MBBS, right? Starting the basic, starting में कुछ भी नहीं. First thing, why are we becoming a doctor? ठीक है? There are two important things you should know. India is a country where you don't have enough doctors for patients, right? People are all around India are literally standing in lines for doctors because there's not enough doctors available. It's a good thing that we are different countries actually are providing courses where we can become doctors, come and clear the FMGE exam and serve our country. Along with that, once you come back here, you complete your graduation and then become a specialist over here, right? All of you will have different reasons. Okay? It's completely fine. पहले ये चीज़ दिमाग से निकाल दो कि यार I am from this country, that country, it doesn't matter. It all matters how much of your knowledge are you putting into practical use. Get that clearly. Okay? Try to understand the concepts. We over here at LearnElevate, let me give you a brief introduction to all the lecturers here, right? So we have all the lecturers available, right? You have seen the different kind of lecturers. I'll be teaching pharmacology. Okay? We have Dr. Kalyani for pathology. We have Dr. Saloni for microbiology. Okay? And we have first year subjects as well, right? We have Dr. Nikhil for biochemistry, right? And we have Dr. Pranay as well. Okay? Now, these are important subjects, including every other subject. You need to get the basics because once you learn these subjects, basic wise, you will be able to gel all of these things together. Okay? There are a few students I know who have reached out to me before going to different countries. Sir, is it better to go to China? Is it better to go to Russia, Kyrgyzstan, Philippines? Yeah, I've met a few people on the way going to some country and then going to Philippines. No direct flight. So I had a long talk the whole flight. I was just talking to them, explaining ki don't worry about it. Sir, it's the practical knowledge. We not having proper patient se baat nahi ho rahi hai. Like first thing, learn the language where you are, of course, but get the basic, I would say an idea what exactly is happening and all. Okay? Now, coming to these subjects, my subject, pharmacology. I don't know. I normally take these classes in front of a huge audience. I've taken classes for approximately 750,000 students. And of course, I asked them, do you like pharmacology? The unanimous, sir, unable to remember, sir. Yaad nahi ho raha, sir. All mycin, isin, this, that and all. How to remember the name, sir? Chalo, naam yaad rahiye. How do they work, sir? There are so many similar sounding drugs, sir. Amiodarone, amiloride. ठीक है, this mycin, that mycin, thromycin. See, all of these things, of course, the names, the nomenclature is a different thing, we'll talk about that later, but you have to learn them stepwise. I teach you pharmacology stepwise. We start with the major first thing. What exactly is pharmacology? Right? Okay, we look into it. We'll go in detail, of course. Now, get this thing also into mind. I forgot to tell you that you guys have an extended 3-year period for FMGE exam itself, because government has slightly pushed the next exam. But it's not like we are looking for just short term, short term चीज़ के लिए नहीं देख रहे हम लोग. We are going for a long term approach to all our students, all the way from first year all the way to the end of final year. Everyone is welcome to our classes. Some people who have joined late, who have had this thing that I have to start studying. Anyone, of course, all of them are allowed to join and enjoy the classes, learn the classes. Yes, anytime, anywhere. Okay, we will be having our application come in. Okay, we have a YouTube live right now, of course, but we will have all of this on our app. All of you guys, please download the app and get into touch with the people over there. Okay, you can leave a message at the Instagram, and you can drop a like, and you can share this video as well. Okay, right now, so pharmacology की जब बात करते हैं, right, people don't really understand how to remember the drugs names and the mechanism of actions and everything and all. So there's a way to reach out and learn pharmacology. Okay, today's class is not about paracetamol, what exactly it is doing, what is the NSAID and all. No. I will not start all of that. Why will I start with all of that? I'll start with what is pharmacology first. पहले समझो what is pharmacology. ठीक है? What exactly does it do? What is a drug? Yes? I'm not going to ask you to remember this. It will come as MCQ. Everything is important. Get the concepts right. ठीक है? By the way, I am Dr. Maska. If you have this thing, I am Dr. Maska. It's my name, Dr. Mohammed Salman Shah. Now, remember that Maska actually means butter. So I teach, and my name is Maska because I teach concepts with a buttery flow. Okay, make sure that the concepts get inside your brain all the way, and all your veins have pharmacology written all over them. Okay, get that concept right. Okay, now conceptual learning is important because if you remember something today, you mug it up. I want to understand this, I want to understand that, I want to just remember it. Then one day you'll remember, why do I remember this? I don't know what exactly it is, but I just have bits and pieces of it. But if you get the concept right, what exactly happens? Tell me. If you get the concept right, you will remember what exactly this drug does. Where was it in your textbook? Okay, what kind of things were happening with that kind of a drug doing on your body? What is it called when a drug acts on the body, and what does a drug do to the body, and what does the body do to the drug? Okay, it's something like you are medical students. What will a medical student do to the medical college, and what will a medical college do to the medical student? That is something called as pharmacokinetics and pharmacodynamics. Okay, we'll work on that. First, we'll go through. Let me get into it. 1 second. So we have the starting of pharmacology. I am Dr. Maska. By the way, I have almost 10 years of experience teaching pharmacology to different medical academy students. Okay, I've taught more than 3,000 students till now, and all of them still remember me for my classifications and my mechanism of actions and etc. etc. Right? So let's get back to this. What exactly is pharmacology? The word pharmacology is very simple to understand. Okay, pharmacology is the study of drugs. Then it's a study of drugs, sir, of course. Then what is a drug, man? Druggy kya hai? Exactly. What exactly is a drug, man? Now, drug is actually any substance that can be used or intended to be used. Sir, ye kya hai matlab? Let us see. When I talk about a drug is defined as what? It is a study of drugs, right? Ology का मतलब क्या होता है? Study. तो study of drugs. But what is a drug? Drug is any substance that is used or intended to be used. Intended to be used, what does it mean? क्या मतलब है उसका? See, if you take a drug, if you take this particular XYZ drug or X drug, either you're already using it, that XYZ, I have fever, so I'm using the drug X, or you're giving it to check what does it do. That means clinical trials. Your intent is to use the drug. So it can be any of those two. So used or intended to be used. Okay. What does it do exactly? So you should do one very simple thing over here. Just draw a box like this. There are like 6 words you should not miss, because this is a definition that is completely, you should use the words properly. Okay, this is a textbook definition or all. ठीक है? So it is used or intended to be used to modify or explore. Now let's learn this. To modify or explore. What does it mean? To modify or explore का मतलब क्या होता है? Modify मतलब change, right? By giving this drug, I want it to change. I want to see what exactly is happening. Right? Hi everyone. I'm getting a few messages. Hi, welcome to the stream from Georgia, from Uzbekistan. That's really nice. Okay, coming back to this. Now, to modify or to explore. Assume that I'm taking drug X that reduces fever. What does it do? Reduces the fever. That's the modification it does, right? It's a high temperature, reduce temperature. Now tell me one thing. Is actually increased temperature a good thing or bad thing? It's a good thing, man. You know something is wrong. You know something is wrong with the body. Fever actually tells you, bro, go check yourself. Something is happening. कुछ खराब है, एक बार जाके देखो. That is how fever lets you know. Second thing, higher temperature can actually kill bacteria as well. So that is two important things that you should know about this. So the modification hai, if you give a particular drug, it can be used to modify or explore. What does explore mean? Explore means that I've given the drug XYZ to see what will it do. I gave this drug. I gave off. What is happening? XYZ drug was given. It is causing nausea. It's causing vomiting. It's causing particular, flow of blood somewhere. Blood pressure is increasing. Blood pressure is decreasing. They're exploring the action of that particular drug. So remember these 4 words. Drug is any substance that is used or intended to be used to modify or explore. 2 important things. What is that? Pathological or physiological. Pathological or physiological. पैथोलॉजिकल मतलब क्या है? ओके, इन्फेक्शन है यार. ओके, इन्फेक्शन है एंड इन्फेक्शन है. वी आर ट्राइंग टू मॉडिफाई. आई वांट दैट इन्फेक्शन टू राइट. हेलो, आई थिंक माय right now. So infection, of course, we are trying to modify it by giving this particular drug, and that is a change in the pathological system. Okay, right. Next is the physiological system. Physiological system का मतलब क्या है? Contraception. Take contraceptive tablet or take conceiving tablet. ठीक है? For example, XYZ tablet. ठीक है? Some kind of estrogenic tablet or norgestrol tablet. This can be used to modify the physiological system. What does it do? It kind of changes the cycle of women. Therefore, conception is not going to happen. What happens in that case? The menstrual cycle starts even though the fertilization takes place, so implantation does not occur, etc. etc. At the end, what happens? It's going to be a contraceptive measure. In the same way, conception also happens that way only. In some cases, they take a few tablets, take a clomiphene citrate, something like that, in which there's going to be a proper, not even just one but maybe multiple ovums are released. So higher chance of pregnancy, the conceiving early. So what are you doing? It's going to change the physiological system. Normally one or two or three will come in. It helps. So get this properly. What is that? What does it tell me? Substance which is used or intended to be used to modify or explore the pathological or physiological systems of the body for what? Benefit of the patient. Okay? For the benefit of the patient. Benefit, always remember, benefit of the patient. The whole point of this is that you try to take medication, not just like nothing like that. So these things, remember, drugs are important for benefiting the patient. Okay? Abuse nahi karna hai. Drug abuse is a different thing, we'll talk about later on. But remember this important thing. The whole of pharmacology lies on this. Okay? It's a study of drugs, and drug is any substance which is used or intended to be used to modify or explore the pathological or physiological system for the benefit of the patient. Get that point clearly in your mind. Now, once we have this basic information of understanding, I will go in depth to understand the first thing, of course, that's going to be your general pharmacology. Okay? The first thing, of course, as I told you before, you learn how to cook rice. पहले चावल बनाना सीखो, उसके बाद बिरयानी बनाओ. ठीक है? Get that concept right. Okay. So, what do we have? We have learning general pharmacology. General pharmacology. After you're done with general pharmacology, think. What will you work on? Any particular system? Any of you please message. I'm looking at the live chat as well. Tell me. After general pharmacology, which is the system you go for? I want an answer from the students joining in. Come on. Waiting for your answers. Think. Once you understand general pharmacology, you understand what exactly in that, you understand what is pharmacokinetics, what is pharmacodynamics, what are receptors, etc. We'll go in detail. We'll take a good look into what exactly it is. Why exactly? Because you want to see भाई ये tablet दिया मैं क्या काम करा. Basic idea of pharmacodynamics and pharmacokinetics, I'll tell you. One is a kinetic, one is dynamics. Difference क्या है? What is kinetic energy? Anything? What is a kinetic energy? It is the movement, right? Potential energy was staying still, right? Kinetic energy is movement. So remember, pharmacokinetics means movement of the drug. Movement of the drug. What does it mean? What happens? Tablet liya up. Okay, it is in your hand. You put it inside your mouth. Okay, chalo. Koli kha liye. Went inside. All the way. Where does it go? All the way down. GIT goes down all the way. And then what happens? So remember, there are very important things in this. They're called as ADME. ठीक है? ADME. ये आदमी क्या है भाई? आदमी नहीं है ये. ADME is very important. Absorption, distribution, metabolism, and excretion. Now remember, all of these are what? These are allopathic medications. These drugs are important to know, of course. They have their side effects, etc. You don't want to stay in your system for a long period of time. So you take it, of course. You want it to get into your bloodstream, go to different places of the body. So what happens? Tell me. what do? You absorb it. The first thing is absorption. Where does it happen? In the GIT. To get duodenum hoga, some of them in the in the stomach, whatever, it gets absorbs and get into the blood vessels. Okay, we learn about that, don't worry about it, we learn about that as well. Next, what we have distribution. This medication after absorption will take a Ola cab. Of course, the Ola cabs are your plasma proteins, right? It will go to different places of the body, all places. Distribution happens. So absorption हो गया, distribution हो गया, metabolism. What is metabolism? Metabolism is that कि भाई उसका काम हो गया, let the liver take care of it. Now remember, liver is very 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 important. You know what is liver exactly? Father of the body, no. Mother, sister, mother. ठीक है, mother है वो. Why, you know? Because it removes it, helps in metabolizing and making it less toxic. Detoxification. आप कुछ भी करे, कपड़े खराब करके आए, spoil everything, break everything, who takes care of it? Mother. Similarly, if you take something from outside via the GIT, it passes through the blood vessels and etc and all, and then has to pass through the hepatic circulation. Once it passes through hepatic circulation, it will undergo detoxification. Detoxification हो गया, and then out of the body. How? Excretion. So remember, pharmacokinetics क्या है? Absorption, distribution, metabolism and excretion. We'll go in detail of exactly what absorption does, distribution does, metabolism in detail, so that ना it sits in your mind clearly. आपका एक basic understanding हर ड्रग का मालूम हो जाना आपको. ठीक है. उसके बाद क्या है? What exactly is next one? Pharmacodynamics. Pharmacodynamics क्या है bro? See, when I talk about, for example, I am from the South Indian side, man. There is Allu Arjun, ठीक है, Mahesh Babu, Allu Arjun, इन लोग भी है, and of course you have actors like Hrithik Roshan, ठीक है. Are they dynamic stars? They are dynamic stars, no? Yeah, dynamic का मतलब क्या है? एक काम नहीं करते उन लोग. They do multiple things. What does it mean? Acting भी करते हैं, dancing भी करते हैं, singing भी करते हैं, many things. So pharmacodynamics means what exactly is it going to do to the body? Different places it goes. For example, that drug goes to the brain. What does it do in the brain? Maybe it may not cross. That is a different thing. It goes to this area. It goes to that area. What exactly are the effects of that particular drug that was taken on the body? Okay, get that concept clearly. Okay, right. So pharmacodynamics. Okay, we'll go in detail, man. This is just the word. Pharmacokinetics क्या है, pharmacodynamics क्या है, general pharmacology क्या है. We'll learn each and everything with the basics. Now, basics are important, bro. Get this clearly in your mind. Anything, any doubt, sir, I didn't understand, ask me again. Of course, we'll have sessions. We'll have Q&A sessions, sir, I didn't understand this, I didn't understand that. Any recorded lectures maybe, or maybe live lectures, majorly live lectures as well. Don't miss these lectures, of course. Okay? It's just not me. It's going to involve every subject. Okay? So we are focusing on development of the curriculum in such a way that you guys have a nice flow. I want you guys to have a proper flow in learning the subject. Okay, so now I was talking about general pharmacology. After we're done with the details of general pharmacology, what exactly happens, excretion hota, etc., dynamic effect of this, and more in detail, of course. After that, you go into systems. The first system that you have to cover is your autonomic nervous system. Sir, why exactly, sir? I hate that topic, sir. अरे sir, what exactly, sir? लॉल not lol नहीं, beta blockers को lol बोलते हैं, ठीक है? All the lols, sir. Everything is lol, sir. Why are they different, sir? लेकिन नाम सामने अलग है ना यार, ठीक है? आमिर खान, सलमान खान, शाहरुख खान, खान है बोल के छोड़ देते हैं. हर एक का अलग अलग काम रहता है. So similarly, lols भी अलग अलग है. It's very simple, man. अलग अलग नाम है. Acebutolol, atenolol, bisoprolol, bitoxolol, celiprolol, esmolol, pindolol, ठीक है? All of these things are there. Timolol, drops है, eye drops है. So these things, of course, we will try to help you understand कि भाई, okay, see, just look at this letter. It comes before this. It helps you remember that it is a cardioselective type. Sir, cardioselective, what is cardioselective? It is majorly towards your heart. it doesn't go to other places, because beta blockers and beta anything that you learn in your channel pharmacology is that you have receptors, and your body has two important very important what is a systems called as the autonomic system. When you go into it, you'll have a receptor. What is that? Sympathetic and parasympathetic. Oh my god, this is so important for you guys to understand. अगर ये समझ गए तो आधा फार्माकोलॉजी समझ गए आप लोग. ठीक है. आई विल फोकस माई मेजर पार्ट फॉर यू टू अंडरस्टैंड एंड रिमेंबर what ANS का what is say sympathetic and parasympathetic. What is sympathetic and parasympathetic? What exactly is it? Adrenergy. अरे ये चीज़ देखिए, फुटबॉल देखिए, एड्रेनलिन आया. You're activating what? Right? When I say, अरे यार, India won the World Cup. How many of you guys are going, yes? That is adrenaline system activating. Right? What happens when I say something? अरे यार, I'm talking about some USA won the World Cup of what? Cricket. वो नहीं जा भाई, USA में क्या है? मतलब क्या है कि पैरासिम्पैथिक. पैरा मतलब क्या है? लेग्स. पैरा उठा के सुकून में चले गए. ठीक है. मीन्स व्हाट? रिलैक्सिंग फेज. सो एड्रेनर्जिक सिस्टम इज गोइंग टू बी वेरी एक्टिव फेज, एंड सुकून का फेज इज गोइंग टू बी अ व्हाट? पैरासिम्पैथिक सिस्टम. वेरी सिंपल. Okay, so once you understand the basic differences between these things, we'll draw exactly which system what works and how exactly is it different in parasympathetic. We'll try to learn in a way where you get it ki bhai ye ho raha exactly, and how to remember this and stuff. Okay, now after you understand ANS, of course, just let me write down this. After you're done with general pharmacology, receptors and stuff and all, we go to ANS. ANS, if you're done with 50% of pharmacology, because all systems will have the receptors that were there with autonomic nervous system. Okay, autonomic nervous system completely you have to understand the sympathetic and parasympathetic. Now, trust me, my specialty is in ANS only. ठीक है. स्पेशलिटी इन द सेंस आपको याद ऐसा दिलाऊंगा ना, फिर भूलना नहीं, दिमाग में ऐसा चिपक जाना. ठीक है. Once you're done with ANS, then we'll go into different systems. Like what? Cardiovascular system, renal system. ठीक है. You have your skeletal muscle, the peripheral nervous system. ठीक है. All of the systems will be covered, all the way from top to bottom. Now, if your the drugs are not systemic drugs, these drugs are for killing bacteria and all, killing cancer cells and all. Chemotherapy, chemical medicines were used to kill either biological things like antibiotics or maybe anti-cancer cells. Right? We'll talk about those also, particularly by I want to kill the cancer cells only. Right? We'll talk about those in detail. We'll talk about why exactly is this name given and why exactly is using these drugs. Difference क्या है वो drugs में? How exactly are they, helping the patient? Side effects क्या है? Okay. Now I follow a basic rule of understanding कि भाई answer लिखते वक्त what exactly do you write down? So it's very simple. For example, I give you XYZ drug. What do? दिमाग में few points आ जाना दिमाग में. What are those? The first thing that you should know should be the name of the drug. Of course, that person itself will say name of the drug. Okay, name of the drug बोल दिया XYZ. The second thing that you should know be that what exactly is the class of the drug as well. Class of the drug. Okay, 1 second. Class of the drug. So, in this book, where exactly does the drug lie, man? For example, paracetamol है. What exactly is paracetamol? ठीक है. Paracetamol क्या है? Get that concept. It is a NSAID. What is NSAID? Non-steroidal anti-inflammatory drug. Okay, वो चीज़ है. Next thing you should know is भाई काम क्या करता है यार? What does this drug do? Simple. You have to understand the mechanism of action, right? Mechanism of action, also called MOA. Chalo, I'll give you always the MOA in the form of flow chart. Why? Let it flow. This is MSSKA classes. Buttery flow of things. Try to understand. You don't have to write paragraphs and paragraphs in this. No, 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 no. You have to explain the examiner कि भाई देखो यहाँ से शुरू हुआ ये drug डाले. Normally what happens? This drug will cause XYZ action. But I gave this medication and this drug is going to cause changes in this kind of action. Okay, therefore the effect was seen. XYZ. Okay, understood? Yes. So that is going to be your mechanism of action. After done the mechanism of action, ka flow chart XYZ. Okay, you come back to this one. Remember, you have to write the uses of that drug. Where do you use? Of course, you're using it, no? Use or intended to be used, no? Yes. So, what do you say? Uses ke baad, you write down side effects. Now, there's a difference between side effects and adverse effects. What exactly is a side effect? What is an adverse effect? This is a very nice saying. See, all adverse effects are side effects, but all side effects are not adverse effects. Right? All adverse effects are side effects, but all side effects are not adverse effects. For example, very commonly seen infection in India. What is it? Very commonly seen. Comparatively अभी कम हो गया, of course, because of the presence of very good medications and proper treatment and all. But it was tuberculosis. It is tuberculosis. The first vaccine that he gives is what, man? BCG, right? BCG क्या करो? BCG is Bacillus calmette-guerin, no? That actually is going to help you against TB. First one. If you are a little bit old, you have this mark on your hand over here. Okay? Feel it. That is BCG only. Okay? Now, anyways, that particular infection ke liye, there's a drug called as rifampicin, if you guys know. Rifampicin, very old drug, man. Okay? Baby old drug, very, very commonly used. Now, the thing about rifampicin is what, you know? It does kill the bacteria, it does this and that, etc. In detail, I'll go, of course. But there's one very unique side effect. It turns the bodily fluids orangish color. It's a side effect. Orange discoloration of the fluids of the body is a side effect of rifampicin. Okay? Is it bad? No. Not a problem. Okay? Don't worry about it. It's not bad. Okay? So that's a side effect that is not. So side effects cannot be always dangerous. But if they are dangerous, they are called as adverse effects. बहुत ज़्यादा problem create कर रहे उन लोग. That will be a problem. For example, tetracyclines, minocycline, take a doxycycline and all. Yeah, they're not given to children. Why? Why are these drugs not given to children? They're not given to children because they will affect the calcium of the teeth and the bone. ठीक है? That deposition अगर affect हो तो क्या होता? It will cause problem with children, right? Teeth and bones will get affected. बच्चों में बड़े तो बड़े हो गए भाई, उन लोग क्या प्रॉब्लम नहीं है. बच्चों को क्या होता? It affects the teeth and bones. So do not give tetracycline drugs to children. That's why. One more important drug. Any other drug that you take, for example, chloramphenicol. Chloramphenicol is a broad spectrum antibiotic. It's taken by babies. What happens? Grey baby syndrome. So there are few very important side effects that you should know, that this particular condition happens in the presence of this particular drug. Okay, and that is where you get this proper thing called as what? Tell me. Proper important thing is what? Understanding each and every drug by itself. पूरा उसका पूरा मालूम कर लेना. You see a case in the clinical world, अरे यार, check his history of drug intake. Okay, check his history of drug intake. Check what exactly is happening, etc. and all. Okay, get that concept right. Okay, so after you're done with side effects, uses, etc. and all, what happens after the side effects are done? Then, if there is place, and if you remember properly, you can write the what? Pharmacokinetics and pharmacodynamics. If you have, and you have proper right understanding of what exactly is being taught, then you'll be having side effects of this. Okay, right. So you'll be done with that answer. Okay, you're done with the answer nicely. क्या लिखे आप लोग starting में बोलो? You start with the name of the drug, class of the drug, mechanism of action, uses, side effects and maybe PK, not American PK. Hmm? Pharmacokinetics. It was taken by this, absorbed in this area, excreted by the kidneys, or excreted by skin, excreted by what exactly? All of these things will be there. Okay, get this concept right. We'll go in detail, we'll try to complete each and every system, we'll go into chemotherapy and make pharma awesome fun, man. Let's put all our hard work into learning pharma. Once you get this properly, everything falls in place for medicine as well. Everything falls in place for ENT, opthal as well, right? This along with the other subjects, other sister subjects like what? Pathology, microbiology, of course, pathology, treatment, pharmacology, microbiology, treatment, pharmacology. To learn all this, you need to know the systems, physiology. You need to know the anatomy. How exactly do this work? We need biochemistry. So it's very, very important to get what? The basic knowledge. Okay, the basic knowledge to understand is very, very important. Get this concept right. Okay, so that is about the starting of pharmacology and how I'm going to go through. The books I'm going to normally going to use is going to be your majorly going to be a Tripathi. I'm not going to lower the standard. Let's go for other book XYZ. I will not name them, but I would say that use the books that I normally mention. Okay, the first book, of course, there are very high standard books as well. I would not say by, of course, read them if you want to. If you have this zeal of learning more and more, you can go for that, or else you get to learn in post graduation if you want to. But the big book that is said to be a gold standard is actually your Tripathi. Okay, KD Tripathi, well known book since long time, and the book that I love. Okay, so I've had my eyes on this particular book since a long time, and then I learned it through doctors on USMLE learning as well. So it was really well to understand the book. The basic, clear cut answers are already given, and I'll make sure that I provide notes for all of these topics as well. You guys can revise and watch the videos as well. Let's not just go for I want to clear this exam and then go ahead with life. Okay, I'm not going to say it's your wish, of course, but I would say that become a better doctor and make it like, of course, I've done it from first year till final year. I've put in my hard work. I've done what I can do. I'm going to put in this thing and learn the subject. Very, very important is learning the subject. Not to just just pass the FMGE exam and then get the doctor title. Ho gaya nahi. Try to understand the concept कि भाई what exactly is pharmacology, ये particular drug क्यों use कर रहे, what does it do, how does it fit into my medical career. याद रखना है आपको, ठीक है. We'll go in detail excuse me, we'll go in detail of the mechanism of action, the different things that it does, and also the uses, and I'll make sure that you guys remember that. I'm going to put in all of my hard work, because I remember I have approximately around, I would say, 40 to 50 different classifications and codes for all the classifications. Okay, codes for all the classifications. For example, I'll just on top of my head, I'm just telling you a few of the classification that I normally use. For example, you have these antibiotics, right? Antibiotics mean, what do we have? There's something called as aminoglycosides. Do you remember? Aminoglycosides, very commonly used ones. Of course, there are problems with it: hearing problem, ototoxicity, nephrotoxicity, neurotoxicity. We'll talk about that when we go into it. But remember the drugs. It's very simple. Aminoglycosides. Remember A for Adolf Hitler. Okay, and that is going to be German soldiers. Okay, salvaged tanks. मतलब they are in a war. Okay, and they're trying to salvage, in the sense I need the tanks for the war kind of situation. And this is a war between the body and the bacteria. So G for what exactly? Gentamicin. Then cesomycin, streptomycin, then tobramycin. Now this A is different, is amikacin. ठीक है, नाम थोड़ा सा अलग है, not a problem. Amikacin. Then do not write neomycin. No, it's not neomycin. It is netilmycin. Get this point clear? netilmycin, kanamycin, and tell me, it's going to be your streptomycin. Streptomycin, cesomycin. Yeah, tanks, not tanks, tank only. Yeah, right. 1 second. Yes, we have tank. Remember that. So we have gentamicin, cesomycin, streptomycin, tobramycin, amikacin, netilmycin, and kinamycin. German soldiers salvage tanks. German मतलब क्या है? Adolf Hitler था ना. वो explain. I'll tell you the whole story when I explain the mechanism of action. How exactly does this particular work in 2 phases? I'll explain that in detail. Sir, which drugs are there? Sir, अभी mycin आया ना sir. और एक mycin भी है sir. Which mycin is that? Remember, we are giving these drugs. Very important. The major thing about giving these drugs is what? Tell me. For the care of the patient, no? ठीक है? Very important. Large amount of macro care. Macro means large, no? Micro is small, macro is large. So macrolide drugs जो है ना, you have macrolide drugs are there, which is for the care of the patient. Care of the patient. Care क्या है बोलो यहाँ पे? CARE. ठीक है? We have to throw ourselves at the patient. Do you need something, right? So we have what? Clarithromycin, azithromycin, roxithromycin, erythromycin. Got it? ऐसा नाम याद रखने का है. ठीक है सर, माइसिन यहाँ पे भी, माइसिन वहाँ पे भी है. ऑफकोर्स है. हाउ टू रिमेंबर दम. ठीक है. मैक्रो इज प्रोवाइडिंग लार्ज केयर. मैक्रोलाइड लार्ज केयर ना. Care is going to be thrown at the patient. Leo mera care. I'm going to give you the best care. Right? Clarithro, azithro, roxithro, and erythro. Right? Similarly, all the classifications have proper codes. Sir, again you'll have a doubt. Sir, ये कैसा याद रखेंगे? You have to practice. ठीक है? No one is going to be like, आज पढ़ लिए, कल याद हो जाता. Maybe a few of you guys are like, you know, suits का क्या था उसका नाम? Mike. Right? Harvey Specter and Mike. Right? अब हर बंदा तो वैसा है नहीं. Even not me, maybe not you. But put in your work. Practice it. I used to do it every day in the morning. Get up and I had a whiteboard. Whiteboard पे लिखता था daily with the shortest form. Okay. By the end of second year, I remembered every medication. So I used to sit in the exam hall and people like, अरे ये कौन सा ड्रग है रे, कौन सा है बोल रहे बोल के. बोला भाई पढ़ ले क्या आना ना यार. Like you didn't give your notes only. Then I started circulating my notes. Like students दोस्ती है ना, पढ़ लेते. It's completely spread हो गया मेरे notes. I still have photos of my notes all the way from 2012. Right? Those notes became famous कि भाई देखो भाई इनका notes है, ये पढ़ लो, you'll remember all of that. Okay? चलो, anyways, I'm trying to impart that kind of knowledge to my students who will remember each and everything. अच्छे से nicely put in their hard work into it. Okay? और एक है, this will help you a lot. There's one thing called as cephalosporins. Everyone hates it, I know. All of you will hate cephalosporins. Am I right? Sir, everything starts with cephalo. Sir, याद कैसे करना सर? ठीक है, सिंपल है. cephalosporins है ना, सिंपल बात है यार. I'll tell you. cephalosporins कैसे याद रखते हैं इसको? We'll see. चलो. Now, first thing you have to understand, cephalosporin में ceph है starting में. Yes. निकाल दो ceph को. Anyways, you have to write ceph, no? निकाल दो ceph. तो सबसे important वाले में चले जाता हूँ. I won't go into too much of detail. ठीक है? But I'll go for the third generation. ठीक है? Commonly asked drug है. There are 5 generations. Recently 4th it became 5. ठीक है? It's very simple to remember all of those. Not a problem. But now I'll go for third generation so that it becomes a little bit easy because I want to tell you a nice story for you guys to remember it. Now cephalosporins 2 टाइप के हैं. क्या है मालूम हो? एक है आप इंजेक्शन लियो, एक है आप गोली डालो. मतलब क्या है? ओरल एंड पैरेंट्रल. ओरल मतलब टैबलेट लियो. ठीक है? पैरेंट्रल मतलब क्या है? पार मतलब क्या है? पारेंट्रल मतलब क्या है उसका? अदर देन एंट्रल. एंट्रल इज योर GIT. Means IM, IV, etc. So we have 2 types of them. Now क्यों सर एग्जैक्टली? नाउ इट कांट बी लाइक सर उसका ऑपरेशन है सुबह में, गोली खिला दो. नहीं नहीं, गोली नहीं खिला सकते. वी कांट वेट फॉर द होल absorption, distribution, this and that. No, I want 100% bioavailability of the drug as soon as possible. Now bioavailability क्या है? Don't worry, we'll go through that when you go through general pharmacology. Okay, right. So over here we have to divide the classifications. Third generation की बात करो ना, मैं third generation की बात कर रहे अगर. So what happens? We have oral drugs and we have parenteral drugs. ओरल ड्रग्स एंड पैरेंटरल ड्रग्स की बात कर रहे हैं हम लोग. ओके, पैरेंटरल ड्रग्स में 5 इंपॉर्टेंट ड्रग्स, 5 ड्रग्स हियर, 5 ड्रग्स हियर. ओके, फॉर राइट नाउ दीज आर 5 कॉमन यूज ड्रग्स. 5 ड्रग्स हियर, 5 ड्रग्स हियर. कौन से है? लेट अस राइट डाउन 1 1 1 पूरे 1 2 3 4 5. सेफ तो है यार, आई एम नॉट गोइंग टू राइट सेफ. ठीक है, बाद में लिखेंगे. गेट दिस कॉन्सेप्ट इन यूर दिस थिंग. ओके, नाउ सो व्हाट डू यू हैव? सेफ का छोड़ दो, डैश छोड़ दो, यहाँ पे डैश डैश डाल दो, डैश डैश. राइट डाउन टी, 4 T's, टी 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 एंड देन ओ. सो इसका कोड रहेगा T4O. T4O, T4O है. ओके, नाउ द फर्स्ट एंड सेकेंड एक्चुअली आर लाइक ब्रदर्स. ठीक है, for example in Asif, Wasif, Kiran, Simran, something like that. Okay, so we have very simple the names of the drugs. Remember, Taxim, Tizoxim, Taxim, Tizoxim. Okay, थर्ड पे नंबर है ट्राई आता. ट्राई ट्राई बोलते ना उसको, बाई ट्राई मोनो. यस, ट्राइएक्सोन. देन यू हैव Tazidime. Sir, how to remember Tazidime? See, Tazidime, I don't know if you guys know, when we were young, I don't know, you guys are very Gen Z guys. There was something called a Tazo. We used to put a rubber band around this area and then you used to go like this. ऐसा करके ऐसा खींचते थे with a rubber band. Tazo, which look like a coin also, and coin also a dime, no? Tazidime. Tazo is also circle, dime is also circle. Remember that? 4 dimes make a dollar बोल के, I know it's not right, but 4 dimes makes a dollar बोल के याद रखो. नंबर 4 पे टैजी डाइम है बोल के याद रखो. ठीक है, राइट. ओके, लास्ट में क्या है? पैरेंटरल है ना. पैरेंटरल में तो आप ओरल नहीं आते आप. सर ओ आ गया सर, इसमें ओरल नहीं है ये. पैरेंटरल इज वाई बिकॉज व्हेन इज गोइंग फॉर अ ऑपरेशन, इफ ही गोज इनटू द ऑपरेशन, व्हाट इज ऑपरेशन? ऑपरेशन जोन, नो, ओपेराजोन. ओपेराजोन, राइट. ओपेराजोन हो गया. जस्ट एड सेफ नाउ. सिफोटैक्सिम, सेफ्टिजॉक्सिम, सेफ्ट्राइएक्सोन, सेफ्टाजिडाइम, सेफोपेराजोन. डन. दैट इज योर पैरेंटरल ड्रग्स. टैक्सिम, टिजॉक्सिम, ट्राइएक्सोन, टाजिडाइम, ओपेराजोन. T4O हो गया पैरेंटरल वाला. व्हाट अबाउट ओरल वंस? ओरल वंस का स्टोरी है, इट्स वेरी नाइस. ठीक है, क्या है ओरल वन का स्टोरी? टेल मी, एनी आइडिया, एनी वन ऑफ यू गाइस? इसकी एक स्टोरी ये है कि चाइना में, ऑफ कोर्स ऑफ यू गाइस, ऑफ यू आर फ्रॉम चाइना, नो, नाम अलग अलग रहते हैं उन लोगों के, राइट. वन चाइनीज गाय, ही वाज लाइक, चलो मैं हैदराबाद जाके आता हूँ यार बोल के. ठीक है, ठीक है, ओके. क्या करा हुआ हैदराबाद आके? हिज नेम इज इक्सिम, बाय द वे. व्हाट्स हिज नेम? हिज नेम इज इक्सिम. सो राइट डाउन, his name is Iksim. Listen to the story first, we'll write it down later. Listen to the story. So what is that? He has a name, his name is Iksim. Okay, he came to Hyderabad. So let's meet around. He went in the morning, long flight, etc etc, पूरे कनेक्टिंग फ्लाइट लेके रात में, आई वुड से अराउंड लाइक 7-8 o'clock को हैदराबाद पहुंचा. हैदराबाद से उतरा, अच्छा फ्लाइट से उतरा, हैदराबाद में आया. I was like, I'm hungry, man. ठीक है, I'm hungry. I want to eat. I want to go and eat, have my dinner. ठीक है, Iksim came to Hyderabad and he was very hungry, so he had to go for dinner. ठीक है, आ गया, चलो. He went to a nice place, Paradise Restaurant or something like that. He went. He like, give me biryani, man. And he ate one full biryani for 4 people. He only ate off. Okay. खा लिया खाना. He was like, oh my god, awesome food, awesome rice, awesome chicken. कितने लोगों का पेट में हो रहा है नहीं मालूम मेरे को. But yes, biryani famous is हैदराबाद. ठीक है, right? No, you know, वहाँ पे लड़ाई नहीं करेंगे हम लोग. Now, Iksim, of course, went for dinner. Yes, had a biryani, of course, and he was so happy. He was so happy that he was like, I will tip you $10. Of course, he was moving around, so he was carrying dollars. So he told the waiter, I will tip you $10. $10 देता बोला ठीक है चलो. ये बंदा वहाँ पे हैदराबादी guy is very unfazed guy. $10 ₹10 देता कहते हैं. $10 रे भाई, $10. Okay, fine. Then he puts his hand in his pocket, removes the $100 thing and just gives it off. He doesn't even see it's $10 or $100. He doesn't see. And this waiter is like, okay, चलो ठीक है fine बोल के. He takes that $100 and leaves. He doesn't see sir, this is not $100 बोल के. लेके भाग गया. अरे इसकी तो ऐसी की तैसी. Then while leaving, Iksim checks his pockets. Iksim checks his pockets and sees कि अरे there's no, I have only $10. I had $110. Oh my god, I gave $100. Damn it. He said, damn it. I gave $100 to that waiter and that waiter didn't even say anything. He called the waiter. Bro, come here. Come here. हाँ भाई बोली क्या हुआ? I gave you $100, sir. Give me 100, I'll give you $10. No, sir, you gave $10 only, sir. Arey, no, I gave you $100. See, I have 10. So maybe you had $20 only, sir. Arey, this is not right. Shit, not good. So he had to tip $10, but by mistake he gave off $100. And then he said, damn it, I shouldn't have given this. And then he started hitting his head like this. My god, I should not have given $100. I should have checked. He started, what is he doing? Taking his hand and hitting his head. What is he doing? Sir, फोड़ ले रहा. फोड़ मतलब फोड़ोक्सिम. Okay, use the फोड़ ले रहा. Now let us put this into work. Let us learn this. 1 second. Yeah. Okay. So what do we have here? First, second, third, fourth, fifth. The first one was what? What was his name? His name was Iksim. Dash Iksim likho. Dash Iksim. Then we have what? He went to have his dinner. Sir, Hyderabad hai kya? Saif Hyderabad nahi tha. Don't worry. He went to have his dinner. ठीक है. He had biryani, etc. And he said, I will tip you $10. I will tip you $10. He gave off $100 by mistake. Oh my god. He said, damn it. Damn it. ठीक है. Then he started hitting his head. What happened? बोलो. Podoxim. फोड़ लिया ना सर. Podoxim. Add Cephs. Cefixim, Cefdiner, Ceftibutane, Ceftamet, Cefpodoxim. Mic drop. I can't drop this mic, it's very costly. Okay, get this concept in your mind. So it's Cefixim, Cefdiner, Ceftibutane, Ceftamet, Cefpodoxim. How many of you guys got it? Remember, Iksim went to have his dinner, had to tip $10, but he tipped $100. He said, Ceftamet. And then he started hitting his head. Podoxim. Yes, yeah. Remember the story itself. That's all. बस story याद रखो आप. आपको ये याद हो जाता. Okay? You'll remember this. Get this concept clear in your mind. Okay? Right? So this is a basic way of me teaching different classifications, etc., etc. Understood? Of course, please drop a like. Please do share, become a subscriber. All the live classes notifications will come to you guys. Okay. Chalo. Nice. Right. So basically, this was about cephalosporin. What are cephalosporins? Antibiotics था वो. ठीक है? So all of these things I will go through with my classes. Similarly, every topic of every class will not be like this is an important topic, this is important. Everything is important, man. I'm not going to say कि भाई पूरी book page to page पढ़ना है, but concept wise पढ़ना है. कि why exactly are you giving this, why exactly is this happening. For example, if I talk about cardiovascular system की जब बात करते हैं ना, you'll have this very important thing called as heart failure. ठीक है, heart failure क्या है यार, what exactly is heart failure यार, anyone? ठीक है, all of this will be repeated, don't worry about it at all. ठीक है, every topic will be repeated, don't worry. This is just I'm telling you a few topics that I know really well. Of course I know the whole thing well, but for you guys to understand that tough topics can be made easy as well. Now heart failure की बात कर रहा था. heart failure क्या है सर? दिल टूट गया सर. हार्ट ब्रेक नहीं बोल रहा मैं, हार्ट फेलियर. फेलियर इज अ डिफरेंट थिंग. फेलियर ऑफ लव ना को समझो. हार्ट इज नॉट ऑलवेज लव. हार्ट इज एक्चुअली अ वेरी इंपॉर्टेंट ऑर्गन, पंपिंग ब्लड बाबा, वेरी इंपॉर्टेंट. ठीक है, लेट इट बी फॉर दैट. ठीक है, राइट. सो हार्ट फेलियर समझो यहाँ पे कि इट्स फेलिंग टू मीट द एक्सपेक्टेशन ऑफ वॉट इट हैज़ टू डू. द होल पॉइंट ऑफ हार्ट इज वॉट? धक 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 धक. वॉट इज दैट? पंपिंग ना. उसका काम है पंप करना, पंप नहीं कर सक रहा. इट्स फेलिंग टू मीट द स्टैंडर्ड्स. दैट इज कॉल्ड अ हार्ट फेलियर. सर विल ही डाई? सर ही माइट डाई, ही विल नॉट डाई फॉर श्योर, बट वी कैन ट्रीट इट. कार्डियक अरेस्ट हुआ, आप हार्ट फेलियर हो तो सीपीआर करते क्या? नहीं करते. क्यों? कार्डियक अरेस्ट हो तो शुरू करते हो. ठीक है, कार्डियक अरेस्ट इज व्हाट? सडनली जाके एकदम से बोल के रुक गया तो है कार्डियक अरेस्ट. वो नहीं नहीं नहीं, आई एम टॉकिंग अबाउट हार्ट फेलियर. So there are different ways heart fails. Right sided heart failure, left sided heart failure. ठीक है, systolic, diastolic. So we'll go in detail of what exactly with a nice diagram a box heart. ठीक है, एक अच्छा सा box उतारे. What exactly happens? Where does the blood come from? Where does the blood grow? And where is your drug going to help over here is very important. Okay. First we learn a little bit about physiology as well. कि भाई the heart is there are 4 chambers of the heart. Yes, yes, very good. Someone wrote, Mr. Sagar, for enable the heart for function. Yes, reduced ejection fraction. Yes, very very important. All of these things are there. Heart unable to or failing to meet its important demand. भाई काम तो करो अपना, जो चीज़ के वास्ते आए थे. Unable to do that, that is happening. Understood? Right. Now basically what we'll do is we'll try to understand by problem क्या हो रही है. For example, there are symptoms, man. People come with, or patients come with symptoms. What are symptoms? What are signs? Symptoms, signs. Symptom is what a patient comes and tells you. Sir, पेट में दर्द हो रहा, सर में दर्द हो रहा, सर ऐसा सर वैसा सर. But a sign is something that you as a doctor elicit in the patient. ठीक है, McBurney's जाके for example appendicitis है, McBurney's point पे tenderness है क्या? It's a sign. He won't say McBurney's हो सर, McBurney's नहीं बोलेगा वो. ठीक है, वो आके बोलता पेट में दर्द हो रहा सर, symptom है वो. What is it? Stomach ache. You will recognize a sign that this part is, science में क्या आ रहा? McBurney's, tenderness, positive. ये चीज़ आप देखते हैं, difference है दोनों में. ठीक है, right? Get the concept. So we'll go in detail with the concepts and understand. भाई देखो, this is a situation. We'll try to go in detail. This particular drug will do this. Pharmacokinetic क्या है, pharmacodynamic क्या है, uses क्या है, side effects क्या है, etc etc etc. Then integration with medicine also is important. That I will do. ठीक है, I will integrate each and every drug with medicine. Put in my heart and soul if you guys show up in the classes on time and have a Q&A session. You have a doubt, you guys can of course ask. Yes, appendicitis, yes, etc. Yes, so these things are there. Get the concept right. Okay, concept तो सीखना है यार. ठीक है, concept तो सीखना है. I don't know if I'm going right. Is it LearnElevate? ठीक है, you guys are from LearnElevate. Okay, so remember that. It was nice taking class for you guys. I know the first thing here, see, आप लोग ना class में you should try to be attentive in the class. I hope I could be a part of this and make you at least properly listen to the class. I've seen that people are joining and leaving and joining and leaving, of course, the starting of a class. But try to make sure that you attend the classes, you try to put in your hard work and you put in your complete attention to the classes, try to learn what the subject is. ठीक है, I don't think anyone else is going to provide it at such a cost effective rate. Okay. I hope that you guys join in and try to become the best doctors that I've seen. I'll be very proud to say that these guys are my students. Love to say that. Okay. We'll see in working offline classes and online classes. I'm going to work with what do you say, Alamin and Nile as well. They've been very helpful, and Aman as well, who has been a very important technical stuff. Everything that is happening over here is going to be said by these three guys only. Okay, I've been teaching for the past 13 years now. 13? Yeah, 12 years. 12 years, 13 almost. ठीक है, मज़ा आता है यार पढ़ाने में. आप लोग आओ, उसका फुल एंजॉय करके जाओ. ठीक है, मज़ा आना सीखने में, मज़ा आना पढ़ाने में. ठीक है, try to put in all of your effort into learning now. I will put my 1000% into teaching now. Okay, all of you please come for the classes. It will be really good to have you guys join the classes. I understand all the things and all. You can have a session where we just talk about the problems that you guys are going through. Okay, don't worry, don't make them say, I have this quote that my people I know used to say that दिल पे मत ले यार. ठीक है, दिल पे मत ले. It cannot handle it. गुर्दे पे ले and go and washroom. बस टेंशन नहीं रहना, टेंशन मत ले यार. Okay, right? चलो, I'll be signing off from you guys. This was my first demo class. I hope you guys liked the class. It was nice to see you. Please drop a like, share and subscribe. Had to say all of this because it's a YouTube channel. You can join, of course, and download the app, and anything is required, you can reach out to these guys through the messenger and all. You have the number showing up in the YouTube thing as well. See you guys. See you later. Bye.